Hey guys, Dr. P checking in. I had a request from a Athos Diet fan from Australia, actually, who wanted to ask about the proper way to break a fast. Now, I want to mention something. When you are doing the Athos Diet fast, you are essentially breaking your fast every 24 hours, right? At some point in that normal circadian rhythm. The Athos Diet does not recommend long-form fasting, I should say, where you're going 3, 4, 5 days. There probably are places for that, but it's sort of beyond the scope of what the Athos Diet recommends. The reason I highlight the differences between the Athos Diet sort of 24-hour cycle and what more long-term fasts can, that sort of stage of things, is that refeeding syndrome is not an issue when you're eating every 24 hours, or when you're eating every day, I should say. And so this is important to keep in mind, because when you are an alcoholic and you haven't had good nutrition for weeks, when you are anorexic and you have not had good nutrition for weeks, you are nutritionally deficient. And I can tell you in the ER, many times what we give people is thiamine, B vitamins. Sometimes people need iron. But in the very short term, you oftentimes need thiamine and essentially B vitamins. And so when you're eating every day, essentially, and getting good balanced nutrition through the Athos Diet, you really don't need to worry about refeeding syndromes in the negative sense. Okay. Now, if you are fasting for weeks, like when you research the old writings of Upton Sinclair, who wrote The Fasting Cure in the early 1900s, those guys were fasting for weeks. And in those cases, you really have to be careful about how you reintroduce food. And specifically, you need those specific nutritional components, thiamine and B vitamins, to prevent you from going through refeeding syndrome. So essentially, don't worry too much about refeeding syndrome when you're doing the Athos Diet. Again, even if you're just eating one meal a day every day, that is perfectly fine, very safe, and you can essentially eat almost anything you want. However, and this is what I've been told anecdotally, and I know from personal experience, when you are eating once a day or for 4 hours or 8 hours a day, you become very specific as to what you want to eat, like very intentional, I should say. And you start noticing as you're introducing food, some things make your stomach more upset than others, and you start realizing you need more electrolytes perhaps, or more water. I will say it's always good to take a magnesium supplement, especially if you have a physical job. It's good to supplement with electrolytes like potassium and sodium, for that matter, assuming you don't have other comorbidities like congestive heart failure, let's say, or on dialysis, or a diabetic who's prone to having high potassium levels. Always a reason for those people that have those issues to talk about the Athos Diet with their doctor. But nevertheless, let's just call it the run-of-the-mill standard individual who's just trying to make their health optimized. By all means, when you're eating, every day, let's say breaking the fast every day, you can pretty much eat anything you want. But listen to your body. Listen to your body. You are the ultimate scientific experiment. And as you reintroduce certain foods into your diet after having not eaten 16 or maybe even 20 hours in a day, you just need to listen to yourself. And pain is important. Nausea is important. Those are signals that something's going right or wrong. So by all means, eat, get your nutrition within that 4 to 8 hours every day. And if you're doing that 4 to 8 hours a day with a balanced diet and getting all the protein that you need and the vitamins you need, nutrition that you need, you should not need to worry about specific foods necessary for refeeding on that cadence or that cycle.